I'm Dr. Mini Salunkhe, Head of the Department of Obstetrics and Gynecology at Momstory, Sahyadri Hospital, Hadapsar. Today we'll be talking about a very important topic, managing postpartum depression. Postpartum depression is the depression and the inability to cope which sets in after a new mother has delivered. She may be a first time mother or she may be even a second time mother, but the feelings of negativity, the negative thoughts which come into her mind, that she is unable to cope with the newborn baby, the demands of the newborn baby. She feels very guilty. She starts self blaming herself because she is unable to cope with the demands of her own body and of the baby. There's a lot of sleeplessness, emotional upheaval, there's a loss of interest, lot of negativity and lot of irritability on the baby, sometimes on your partner, on your family members. You feel very sad, you feel very low. The patient feels very tearful, she's constantly crying and she thinks that I'm crying for no reason. But let me tell you, these symptoms are there after the delivery. There might be an acute phase in which you feel very low immediately after you've delivered. You're very tired at that time. So this might set in within a few hours, or it might set in within a few hours to a few weeks. Within 6 weeks there is a subacute phase, or there is a delayed phase which comes up after 6 weeks. 6 weeks to 6 months, that it gets prolonged. Because what happens is that since you've not spoken it out openly, what is happening to you, you've not spoken to yourself or to your family members, you're unable to understand what's happening. And this phase goes on and on. How do we treat these symptoms? What can the new mother do for herself in such a case? So there is something called talk therapy, psychotherapy. So the first thing in talk therapy is talk to yourself, treat yourself. So how do we treat yourself when you have newly delivered? Get enough sleep. Whenever the baby is sleeping, try to get enough sleep. Eat well, have a good hydration. Talk to yourself, talk to your friends, your support group, your partner. Tell them what you're feeling. Tell them that you're unable to cope with the increased stress mentally and physically. Another very important thing is, try to avoid all these unrealistic expectations. You feel that you're a new mother. Oh, I can do everything myself. I can look after myself. I'm a superwoman. I can look after my baby. I don't need any help. So please don't reach out. Please reach out to your people. Reach out to your partner. Take support from your family members. The family members, of course, have to give a lot of support and tender loving care to the newly delivered mother. So try not to be a perfect mother. Your reasonable expectations, and try and get enough sleep and enough rest. Try to relax. Try to do a lot of yoga and meditation. And even postnatal exercises will also really help to boost your morale. There is something called the rule of 555, the rule of postpartum 555. What is this 555? 5 days in bed, 5 days on bed, and 5 days around the bed. What does that mean is enough, at least 15 days of enough rest. If you're a first time mother, for you and your newborn child. If you're a second time mother, that period is there for bonding with your first one also, because they also need a lot of support and a lot of your attention. So try and do these things and relax. Try and do deep breathing exercises and your postnatal exercises. Secondly, we talk about the supplements which are there. There has been a study in which they say calcium, vitamin D, these deficiencies of these also might exacerbate the postpartum depression. So try and take these supplements properly and take a lot of vitamin D in your supplements. Now this is the self-talk or the talk therapy for yourself, what you can do. Talk about your concerns. Secondly is, if this is not helping, talking to yourself, talking to a support group, talking to your family members and partner, then we have psychologists. Mental health psychologists are there who will professionally help you to tackle these symptoms. But my sincere request is that don't ignore these symptoms, because sometimes they may escalate and lead you to a long-term depression which may even exist beyond the 6 weeks. Supposing the psychologist, talking to the psychologist is still not helping, the therapy sessions are still not helping, and the patient is unable to understand what is happening to her, then the last resort would be to meet a psychiatrist who can give you some medications to combat the illness and the depression, which might become a little more problematic. So my sincere advice to you is that postpartum depression is a very temporary thing. Please look into the matter, relax, try to get some time for yourself also after managing your baby, and with self-talk and therapy, help from the family members and from the psychologist, things will be absolutely okay. For more information, please visit Momstory, Sahyadri Hospital, Hadapsar.